Believe it or not, today marks 435 days, 63 weeks later, since our first case of COVID-19. Sadly, though, we had one person pass away from COVID-19, a woman in her 70s, which now brings our total up to 379 people that have passed away from this. My condolences and prayers go out to the family. It's a tough time. It was a tough time when people were losing someone last year, and it's a tough time to lose anybody, regardless of what they've passed away from. So please keep in mind that COVID is still here. We are getting out of this tunnel. We're getting away from everything, which is good. But people are still, unfortunately, getting sick, and people are still passing away from this. As of yesterday, we had 59.8% of Albany County's population has received at least the first dose of the vaccine. 51.8% have been fully vaccinated. Compare that to the state levels. 51% are fully vaccinated or had their first vaccination, and 42.9% had their second. So our numbers are still good here, but we still need to do better. And again, getting a shot in the arms, a shot to staying open, getting fully open, especially for our arena football, and getting past
Absolutely.
that 33% capacity that we're at, and getting back to a full crowd. So we're getting there. As of today, Albany County has administered 66,677 vaccines, first and second doses to date. Albany County alone has administered 26,700 vaccines out of that number. So we have a lot of great partnerships going on, and I can't thank all the partners, and from the Albany Pharmacy College to all the pharmacists in general, to John McDonald or somebody member that was out there, to our pharmacists on Lincoln and Delaware and Martin Avenue. I think I should remember that. But again, to everyone, to Jay, to everyone out there doing a good job, thank you. And Colony EMS, Gilliland, all the EMS systems, so thank you. Those include 234 doses and 216 second doses at our CAP Center yesterday when we had our clinic. We had 69 walk-ins yesterday, which is good. People, like I said, sometimes people just don't want to think about getting the shot, and when it's available, they walk in and they just basically get it without thinking, and that's okay too. I know there's a lot of that anxiety with people that don't want to get it. And so far, we only handed out 130 Dunkin' Donut gift cards and 370 free ice cream cone vouchers for stewards for those getting vaccinated. No, none of them went to my deputy, Dan Lynch. He actually had to pay for his mother's ice cream, which I think broke his heart. So I'm looking forward to another announcement on Monday about another initiative. And, it's funny, I have gotten some feedback, some negative feedback from people saying I did my job. Hey, sometimes it takes a little extra to get people out there. Sometimes it takes people, look, I don't know if there's anyone, maybe these two, but I don't like getting needles. There's a lot of people out there that don't like it, and there's that anxiety and trying to wrap themselves around it and the different vaccines. Just be happy they're getting the vaccine, want to get the vaccine, and we can get back to some type of life the way it used to be before COVID. So yesterday I announced 2 more mobile pop-up vaccine clinics coming. One tomorrow at the Innovative Block Party on Clinton Avenue Street between the 3rd and 4th Avenue. And that will be open from 12 p.m. to 3, and it's being done in partnership with a Village and CDPHP. The second one will be on Wednesday, May 26th at the Church of St. Patrick's in Ravenna. It will be from 4 p.m. to 7. Also, Sheriff Apple's doing still some little pods and vaccination at houses, as well as other pharmacists and people partnering. So please, there's a lot of varieties out there. This is being done in a partnership with CDPHP, Community Care Physicians, in the town of Queens. So thank you for all them. The residents also have an opportunity for the Pfizer vaccine every day at our county building, 175 Green Street, from 9 a.m. to 3. No appointment necessary. You can walk in. Anyone over the age of 60 that doesn't have transportation, or you just are nervous about driving there, we will pick you up. We will bring you to our clinic. There's someone there to talk to if you want to just get some information and you want to find out about everything. We're there for you. We'll take you. We'll take your aide or your loved one, or the person you might not like and you're dragging them with you anyway. So we'll make sure that we get you there, talk to you, get the vaccine. So please, that number is 518-447-7198, 518-447-7198. Additionally, we're offering walk-in Pfizer vaccines every Friday at the Emmanuel Baptist Church at 275 State Street. And anyone can show up anytime between 10 a.m. and 1. No appointments necessary. This is also being done through a partnership with CDPHP and the Focus Churches of Albany. As of today, there's been 24,223 cases of COVID-19 in Albany County. We have 27 positive cases since yesterday, which is definitely higher than what we wanted to see. We had 9 a couple days ago. We were getting there. We're just going up a little bit. The 5-day average is at 16.2. Before that, it was 14. So we are creeping up a little bit, and we obviously Dr. Whalen and her team and our team here are going to be watching now that mask mandate has dropped, and to see how it's going to be as these next couple of weeks. As we know, when we watched Holidays a long time ago, it feels like it was a long time ago. We'll watch the numbers, and hopefully that's just something, just a little bit, it's going to stay there. Of the new positive cases, 7 had close contact, 18 we're not sure of. There are now 103 active cases in Albany County, up from 97, so we're up a little bit, but still a lower number than what we've been dealing with. There are currently 312 people under mandatory quarantine. Yesterday it was 297, so there were 19 recoveries since yesterday. We've had 3 new hospitalizations overnight. 14 are currently hospitalized, and yesterday we had 15. So there are 5 patients in the ICU. The day before that was 7. We continue to urge people, please get tested. I know the testing levels are way down, so I'm not going to get into the website. I mean, we need still people, if you have a symptom or you think you might have contracted it, look at it. The other thing we're looking at is we have put guidance out, our health department will, to school districts. I know kids, when they get a stomach ache or a cold or a sniffle, they have to get a PCR. We're beyond that. We don't want to do this to the kids. It's tough when they have to get that done. And, so the guidance have changed from the CDC, and we're asking the school districts, for the parents' sake and the kids' sake, of, traumatizing them every time of going out with a cold or a stomach ache or whatever it may be. And in the schools, we're being cautious and doing their job and protecting everyone within that building, which I commend. But we have to back up a little bit now and, work with it. And again, they were the recommendations in the beginning. Now, we just don't need to get these little kids tested every second of the day. So please, we encourage people to get the vaccine, keep the spread of COVID under control, so we can continue to move forward, and most importantly, continue to open up our economy. I know I've gotten a lot of questions on a lot of owners and restaurants that can't open up because they can't get workers. All I can tell you is that there's people out there unemployed. We have to get people back to work, and we have to get the people that are home back into these jobs so we can continue to open up. And I've heard from a lot of business owners that they're like, hey, it's great if I'm at 100%, but I can't open up because I can't get the business. I know someone that purchased I think it's a Stout. Don't you hang out there at lunchtime, have beers and chicken wings? The Stout down on Broadway, it's a new owner, and they can't even open up the doors because he needs 40 workers, and he can't even open the door to his new business because he can't get anyone hired. So there's a lot of frustration out there. People, please, college kids, high school kids that are virtual, please go get a job, help be part of this, get these businesses open so we can continue to have them. They're a fabric of our community, like arena football. This is the backbone of our community, and we don't want to lose these, I say mom and pops businesses, but that just keep us going in the right direction. It's one of the reasons why I have Bob Belber here, who's the general manager of Albany County's Times Union Center, and we also have the Albany Empire coach with us. Tom, thank you for being here, Coach. I appreciate that.
Appreciate it. Thank you.
Manis, is that how you say your last name?
Manas.
Manas? All right, I should
Close
stop.
enough.
I should have just said
Coach Tom's fine.
Coach Tom, is that all right?
That's good. Yeah.
Can I try out? Is it too late?
Well, actually, yes.
It is? Do we get leeway as county executive?
Well, we'll get you in.
You think I do all right?
Yeah, oh yeah.
Than's for lying, Coach.
Yep.
So I appreciate that. That's what they do. They build up your confidence, and then I would have got crushed.
Then we cut you.
Yeah. Come on. You had to say cut, right?
All right.
No, you probably would. It's been a rough 2020, and the TU was closed. We didn't know what we were going to do. It's a 17,000 seat arena, and you look at the great Palace Theater that we have in downtown Albany, the Capital Center. You look at the Egg. We have so many things down here that sat vacant. And again, what's a society without music and plays and shows? And especially we got the SOS here at the Palace that had, David Allen Miller. Sorry, Dave. He's going to get mad at me, but I apologize. It's awesome, and we need to get back to some type of normalcy. And 2021 is starting to get there, and we're starting to open up, and we have a lot of great announcements that's going to work. We have the arena football, Albany Fire Wolves National Lacrosse is back, here, which is awesome. And obviously, fans are returning about 33%. It's a little less under 4,000. We're going to adjust. We're going to have sections that are for vaccinated people, sections that are for non-vaccinated people, concessions for non-vaccinated people, concessions for vaccinated people. Separate bathrooms. You're covered. You're going to be comfortable. There's going to be nothing to worry about, and that's what it's about. And it's about the fans. And I'm hoping as we go on, Coach, we're going to get past that 33%, and we're going to try to adjust to get more in there. So please, we're trying not to exclude the fans that for whatever reason didn't want to get vaccinated, don't want to get vaccinated. I get it. But we're trying to make everyone have a part of this great experience that we're going to get back with the arena football. So, but to bring things to my next point, that's why we're relying on the New York State Excelsior Pass, and who's been vaccinated. And there was a good article in the Time, I think it was the Times Union, or maybe it was the Times Union, I believe, Times Union article story yesterday about people not being able to get their vaccination pass, right? There are a number of reasons for this, including ERA, the app, can be confusing. I went through it. It can be very confusing. Example of this is typing in a nickname instead of your full name. It's not going to work. Some people go by their nicknames. Or entering a county instead of which we actually had it. One of the things we learned the hard way was the partnership we had with Mohawk Ambulance. So we've had multiple pop-up sites. We did vaccinations and partnerships with Mayor Sheehan and them. Everyone they vaccinated, if you don't put Schenectady County, you're not going to find your name. We didn't know that, so it was kind of interesting, so we were reaching out and letting people know that you have to put Schenectady County, not Albany County. That's one of the reasons why you can't get your the passport. So please, people, pay attention to that. And you don't think you would? We never thought of that. It would be that way. There a lot of user error, or it also could be an error on the side of the vaccine providers when initially inputting the data. We have noticed, that some of the places weren't inputting the data correctly or didn't put the data in. So we've been trying to get our hands wrapped around that to see how many people actually got the vaccine but are not counted. We're not sure, so I'm not, we're just, as we're reviewing it, our numbers could be higher. It's just the fact that for some reason some providers might not operate an error as it went in, or just their name didn't get into the system at all. So we're looking into that. So I hope the state develops an app that's more friendly, or the health department of health gets into the 21st century. We got to make this simple. We got to make it simple for people. We can't make it confusing. We can't make it challenging. And come on, we're the state of New York. We do a great job. We're resilient. So please, we need to work together. It's a tough system, and we need to make it better. These businesses have sacrificed a lot over the last 14 months. We should invest in a system that actually works for the people. It's one of my pet peeves. We've been saying this since the beginning. I don't get it. Technology's there. It's just like Odada that had to take my $29 million that they wanted so quick, and they figured out how to take our money back from the counties. But Mike Heim from there said they were going to have an app out and it was going to be available. Well, the week's over with Mike, and it's not here. And it probably won't be here next week. But again, we're the state. We got to do better than this. We have to get through this. So please, we need a state-of-the-art public health information system that fits the 21st century. Governor Cuomo and his team have done a great job getting us through this. We just got to get the technology introduced so we can continue to do it, like that friendly app that we made, to that pre-registration, to make it simplify and take out a lot of the drama of registering to get your vaccine or worried about getting it. Pandemic isn't over, people. We need to continue to just cough in our arm, clean our hands, and stay 6 feet apart. Wear your mask where you feel appropriate. I was out and about, and I was kind of surprised. A lot of places I went into, people still had their mask on. People are still walking around with their mask on, which is good. I went to a fundraiser last night, and I have to tell you, I was a little freaked out. I walked in with my mask on,
Right.
which is good. Hides my ugly face. So I was like, it was kind of neat. Walk in, and then no one had a mask on. So I was like, all right, I'll take it off. And it was just weird seeing that many people in a room, embracing. People are hugging because they haven't seen people in over a year. Some people just showed up, probably not for the fundraiser, just to see somebody. And, and like, we don't have to wear a mask. I was one of the nervous ones. And, but again, it's things are opening up. We have to be cautious as we move forward. Again, if you feel uncomfortable, wear that. It's still going. I went into Dunkin' Donuts this morning, got a cup of coffee, and everyone in there still had masks on. People getting coffee. So it's kind of neat to see that people have brought into this and know that it has made a difference in people's lives. So thank you, Bob. Why we're here too to talk about this great arena football and our coach here, Bob Elver, Times Union Center, please.
Sure. So thank you, Dan, and I agree 100% with what Dan said. Some people still should wear masks if they feel like they need to or want to. Inside the arena, and this is the New York State Health Department guideline that we have to follow, inside the arena, people will be required to wear masks unless they're in a vax zone, and I nickname it the vax zone. It's a couple of areas that we've established that are strictly for people that have been vaccinated fully. And so once they're in those seats, they can remove their masks. It's optional at that point. But any other locations throughout the arena and in the common areas, masks are still required. And until you get to your seats. And if you're going to consume food and beverage items at your seat, then you can take your mask off at that time and put it back on when you're finished. There is a requirement to show proof of vaccination. As Dan said, the Excelsior Pass is something that we are accepting. We also are accepting if someone wants to bring their vaccination card as a alternative. And then a proof of negative test result, PCR test 72 hours in advance, or a rapid test within 6 hours of the event is also acceptable. And children, this is another thing, in the vaccination zones, children that have not been vaccinated because they're not eligible, or if they're eligible and they haven't been vaccinated yet, are going to be allowed to go in the vaccination zones with an accompanying vaccinated adult. So just want to make sure you're aware of that. The state is not separating families in this case, which is a great thing. And we're really looking forward to what's coming up. Dan, do you want to make the announcement in regards to?
Please.
Okay.
Go ahead.
So this is a pretty cool thing, and I want to thank Coach Tom and the ownership of the Albany Empire. So on May 29th, we're going to have the health department, Albany County Health Department, with great Commissioner Elizabeth Whalen, has done such a great job throughout all of this pandemic. They're going to have a pod there at the arena where people will be able to get a vaccination. And anyone that comes to the arena on May 29th will actually get a free ticket for a future Albany Empire game starting on June 12th and for any games in the 2021 season. So they'll be able to come through the Beaver Street entrance and either get the vaccination and leave if they're not planning to stay, or if they don't have their won't have the proof of vaccination, but if they're not negatively tested and able to get into the game, they're still able to come and get the vaccination and go out the same way that they came in. So it's going to be a fun way for us to provide an incentive. There's also going to be on May 29th a Vax block party. And so the Vax block party will not be on the street. The street block parties will resume and begin on June 12th. But on this game, on May 29th, there will be a block party on the mezzanine in the atrium with live entertainment, with food and beverage. But you will have to be fully vaccinated to be able to get into that zone. And there will be somebody checking to make sure at the entrance points to the Vax block party. So just want to let people know we're encouraging vaccinations. It's a great way to stay safe and certainly provides added benefits.
Which is awesome. And listen, we're also going to be offering J&J at the first game. So any fans that show up that have not got the vaccine and you want to get the J&J, which takes 10 days after you get, can come to, we'll get a future ticket. to a future game, but when we do the next party, which will be outside at that point in time, you can come to the party and you'll get a free ticket for the game. So, again, talking about that, Coach, seeing that you were going to cut me after I tried the first game. But please, talk about the upcoming season, the excitement, where your team's at, but please, Coach.
Okay, well, first of all, thank you for having me. As of right now, if you look at any of the polls on paper, everyone in the country has us picked to win everything. I don't know what they know that I don't know, but I'm grateful for the enthusiasm that's being generated. We have a team that is a combination of both veterans and veterans and rookies rather this year, which is a little unusual. A lot of teams prefer all veterans and or all rookies, depending on your situation. We have a nice blend. We've got some great leadership on our team that's been very successful. The biggest thing for us is we don't want to confuse ourselves with our predecessors, right? We are our own identity. We're coming into this. We're grateful for the path that they've laid before us with the fan base and the enthusiasm, and now we want to take it to the absolute next level for a long period of time. We plan on being here for a long, long time and being a part of this community. That being said, our season starts on May 29th, which is just, if you go by my clock, it's 7 days from today. Today's already over. We finished practice, so we got down to our final roster. So we'll be posting that shortly. Matter of fact, a little side note, I think some of you know we had a tryout before the season started for local talent here, and believe it or not, I've never seen it happen ever. We had 2 make the team.
Wow.
Which is incredible.
What happened to
me? Yeah. You weren't you were the third one.
Okay.
So we had 2 make the team, and they're both starting, which is incredible. Which goes to show that football is a game of opportunity, and given the right opportunity, they took advantage of it. That being said, looking forward to this year, after the 29th, we have a shortened season. And this is why I really encourage people who have not been vaccinated to go out and get vaccinated and fill this place, because we only have 4 home games this year, 4 regular season home games. Our ownership could have decided that's not enough, we'll cancel it, we're going to lose money, and trust me, we are going to lose a tremendous amount of money putting on a season this year, but we're doing it for this community. That's it. We're doing it for the town. We're not doing it for selfish reasons. We want to have football here for you, and so we've made that commitment. Our ownership has. That being said, with the 4 home games, and then we go to a short playoff season, which is 2 games. Now we have the opportunity, if we do well during the regular season, to host those games. So potentially we could have 6 home games. That's our goal, is to play the playoffs here and then the championship here. And I think our block party would be quite nice at that point. So we understand we're playing in front of a limited crowd. Whether we were playing in front of 1 resident or we were playing in front of 3,500, we're going to give you the best of us every time we come on the field. That's my commitment to this whole program. And I think our players feel the same way. I would like to say something on a side note. First of all, my condolences to those that have passed due to this terrible virus. But we, as a team, some are vaccinated, some are not. Some it's cultural, some it's fear, right? And all I can say is this, is that you, by getting this shot, don't think of it as getting this shot for yourself. You're getting it for people you love. So I know now I can go kiss my aunt. I can go see a grandfather. I can go hug my grandson. We can do all those things for them by being vaccinated. So make it an unselfish act if that's what you need to do, okay? But I look forward to seeing everybody this year, and God willing, we'll get through this season unscathed and champions. Thank you.
Here's to that, Coach Tom. And you know what? Thank you for that bit of advice about getting the vaccine. That means a lot. Again, you summed it up perfectly. So thank you for that. And to the fans, like you said, 4 games. So please, let's come support our teams. Let's get out there. To the owners, I do want to say this about the owners. I do know, and I wasn't going to say it, and I'm glad you brought it up, because I get in enough trouble on my own, is the owners did come to us, and they are losing money to have this season, and they knew that, and they still went forward, and I commend them. And I didn't want to say anything, but I have to tell you, to their commitment, not just to the team,
Right.
and to the players, but to the fans of Albany County and to the Capital District.
Right.
They're committed, and they knew that this season meant more than them making a profit. Let's face it, you're in a business, you need to make a profit, you want to make a profit, but their commitment was to the region to say, look, we're going to open up and give you something to look forward to. They really want this season to happen. That's why they changed and did the 4 games. So my hat's off to the owners, to all the owners of the arena football, for making this happen. So thank you, and thank you, Coach, for the inspirational
You're
words. And to the 2 walk-ons, that's awesome.
Yeah, it's a great story.
That is a really great story, to have 2 local people get on the team, which is great. And talking about awesome people in the community, is this is National EMS Week. Being a former firefighter and first responder and an EMT, I know the job that men and women do day in, day out. I want to thank you. I seriously want to take the time to thank you. They're there for us. They're there for us at our worst moments. They're there holding your loved one's hand in, whatever the situation might be. So please take the opportunity to thank our EMS community. I do want to, we have great EMS in the system, and from the colony, like I said, Gilliland, Green Island, Cohoes. I'm going to stop there because I'm going to get in trouble because there's too many of them. But I do especially want to say thank you to the EMTs and EMS that really made a difference in this COVID world going forward. So as this spiraled out of control, especially the way the EMS was handling our at-home people, going there, getting them shots, and talking to them and spending the time, because it's time-consuming when you go to one person's house and you got to give a vaccine shot, and then you got to wait the 15 minutes to make sure they don't have a reaction, to educating them when you get there. So you figure they could be in that house for over an hour, or at least a good hour, and times that you only got 24 hours in a day. It made it harder, but it shows the commitment, Albany County's EMS department had through Sheriff Apple's team. So thank you for everyone, for everything that you do, and you're all heroes in our eyes. So also, please go to the state website, 1-833-697-4829. As always, our 211 hotline, and then the albanycounty.com. Mental health support still available. We may, like this, we may start coming to an end with that. Not that many people are calling. Very small. I think we might get 1 or 2 phone calls. I actually went to have Dr. G talk about that, but that's good. That means people got through the COVID, through the mental health adjustments, and now that we're out of this, are okay with the way things are. So, which is good. Our 24-hour sexual assault hotline number, please, as always, 518-447-7716. We have texting, we have email, so people that are afraid or that the person they're abusing them's around, you can text us, you can call us, email us. We're there for you. And please, everyone, stay safe out there. People aren't vaccinated, please wear a mask. People that are, continue to do the right thing. And we're almost there. We are almost there. Be safe out there.